So I turned 50 a few months ago, starting to see signs of aging, and I wanted to know if surgically there are things that we can do to start working on those things. I feel like my lids are a little heavy. I've heard about lip lifts. I know this is starting to come down. I don't know if it's time for that, so I just wanted to see from your perspective what we could do surgically.
Well, you look fantastic. You really do. You are aging uniformly. You have beautiful skin. And I really don't think that there's one particular area of your face where you're showing a tremendous amount of aging. It's all relatively uniform, and it's nice and controlled and slow, which is what we want. Nevertheless, once we hit the 4th, 5th decades, we're all human, and we're going to start to show signs of aging. And it's always better to do things earlier than wait, because there's a number of reasons for that. First of all, the tissue quality at your age is far better than your tissue quality is going to be, say, 10, 15 years from now. So we really want to take advantage of the opportunity to utilize your good tissue quality, good elasticity of the skin, and just good fundamental strength of the tissues. Are you doing non-invasive things now, like Botox?
Yeah, I've done Botox, I've done sculptural fillers, lasers, but I was told that there comes a time where maybe that should slow down, and then we should start to look at other options that are more permanent.
Great. Yeah, well, you're very well informed. I think all the non-invasive things that you're doing, neuromodulators like Botox and Dysport, are going to be great to maintain that longevity for you. And filler, because we all age by sagging and volume loss. Those are the two fundamental ways that we age. And everyone's got a different proportion of sagging and volume loss, or a different combination of those two things. In terms of volume, you're very lean, you're a very thin person. I think from the standpoint of volume, you're doing really well, whether that's some of the filler that you've had or whether you're really hanging on to the plushness of your tissue. That's a great thing. I am seeing a little bit of hollowing in the temporal area, which is very common in lean patients when we get into our 4th and 5th decade. But it's not anything that's dramatic at all in your case. It's more of prevention, something that I'd like to keep my eye on. Outside of that, I love the position of your brow. I think things are in an excellent place. You don't really have any upper eyelid hooding yet. I can see your eyeshadow. The shape of your eye is excellent. So all things that we'll keep our eye on, but right now I don't think surgical intervention is appropriate. And with regard to your mid-face and your lower face, we're just beginning to see the start of some tissue descent and a little bit of that mid-face and lower face aging. I think it is a little bit early in your case, even from a preventative standpoint, to be considering any surgical intervention. But it's great to have this conversation, gather information, and know what your options are with regard to the future. I think you show an excellent amount of teeth when you smile. It's always important for us to evaluate the upper lip length and the distance, because both women and men age by having lengthening of the upper lip. So we want to keep our eye on that, and when that upper lip length increases too much and we're not showing enough teeth when we talk and we smile, that's the time to intervene, and upper lip lifts are a great way to really add balance to the face.
Okay. And how about my under eye area?
Little bit of hollowing.
Okay.
I don't like filler in the under eye, and there are several reasons for that. I love filler in other places. I think it's wonderful in the cheeks and the lips and the nasolabial folds, but I am not someone who believes in filler in the under eyes. In my opinion, that causes a lot of long-term issues that are very difficult to deal with. However, many patients do have hollowing in the lower eyes, and we need to be able to address that. My preference for addressing that is to use your own fat. Fat is typically taken from places where we have extra fat, usually the love handles, we process that fat and use it to fill in the hollowness of the lower eyelids. It can help with volume loss and it can help with coloration as well.